Crisis looms as COVID-19 cases continue to outnumber bed spaces in some states in Nigeria. This latest development is, however, not helpful towards the effort to flatten the curve of the pandemic in the country. Against this backdrop, some medical experts are sounding the alarm about what they call gloomy prospects ahead. Joining us now to discuss this is Dr. Doyin Odubanjo, a public health physician, Executive Secretary of the Nigerian Academy of Science, and the immediate past chairman of Association of Public Health Physicians of Nigeria, Lagos chapter. Welcome to the program, Doctor. Good morning.
Thank you. Good morning.
Good morning, Dr. Odubanjo, and thank you for joining us.
My pleasure. Good morning.
Well, what's your assessment of where Nigeria is at the moment with the management of COVID-19? Have we reached the peak yet? Is there any hope that the curve is going to be flattened anytime soon? Or do we have reasons to still be afraid, considering the fact that both Nigerians and even our leaders are not necessarily following the guidelines?
Okay, so great. I have 3 questions in there. One is, have we reached the peak yet? And I think largely most of us would agree that we probably have not reached the peak. Sorry, just a quick correction. The name is Odubanjo.
Odubanjo.
Yes,
okay.
please.
Thank you for that correction.
Right. So most will agree that we haven't reached the peak. However, if we're speaking scientifically, that's just by observation and perhaps by expectation. In terms of numbers, we probably have too many issues with our testing capabilities for us to be able to say definitively where exactly we are. But again, like I said, I don't think there's any much dispute among all related stakeholders about the fact that we haven't reached the peak. Second question is about how we flatten the curve, and that, for me, the first thing that comes to my mind is that I keep wondering whether when we talk about flattening the curve, we are all meaning the same thing, or people have different impressions on their minds. And for one, I hope we know that when we talk about flattening the curve, we're simply saying we don't want to have too many cases at once. And that also implies that we expect to have the cases, but we want to have it as a long, drawn-out battle, meaning that we want to have the cases over a long period of time and not have them in a short burst, in which case we could readily get overwhelmed and might not be able to cope. And so even fatalities might rise drastically because of that. So that for me, the things we need to do are the things that we're already talking about, the social distancing and all that. But I like to think about them in terms of something I'd seen where somebody classified them as the 3 Cs. But first, let me say that basically it means that we all have to, work together on this issue. We'll all have to understand that it's about how we behave. It's about what we do and what we don't do that's going to determine the fact that we can control this and ride this wave very carefully over a period of time. And so the 3 C's will be to avoid close contact with people, to avoid crowded places, and to avoid closed spaces. So in essence, it also, of course, will entail how often we go out and where we go to and all of that. So once we can modify behavior, we will help to ensure that we can have a flat curve and not a curve with a high peak, in which case you could now start announcing, say, 1,000 cases every single day. And when you have that, it's very difficult for any country, as we have seen, to cope with that. I think there's a third one, but I'm not sure I remember exactly what that is anymore.
No, I was referring to the behavior of Nigerians and also our leaders who seem to be leading the campaign, and how people are not observing the guidelines.
Well, I think simply we seem to have outgrown the fear. When we started off, we had 2 pandemics. We had the pandemic of coronavirus, and we had a fear pandemic. And I think what has happened is that somehow, some way, we are tired, and we no longer as fearful, as we used to be, which is why people are abandoning those guidelines. However, we should know that if we want a flattened curve, then it means living by the guidelines for a much longer period of time than we probably will find comfortable.
Well, you've correctly observed that people are less worried about COVID-19, which should not be the case, because right now we're looking at running out of bed spaces as infections grow. We're also looking at even countries who have managed to control it are worried about a second wave. So let's talk about where we are now. It doesn't give the greatest sense of confidence Nigeria's handling of this situation, because as of today, we only have 78,244 tests for COVID-19. Right. This is far below the 2 million tests Nigeria set for itself. So if we're falling below there, also running out of bed spaces, it does give the impression that we're not on top of this situation. Is that a correct assessment?
Not exactly, and I'll tell you why. Because if you observe globally, you probably won't find too many countries. Maybe you can count them on one hand, but people actually felt we're really entirely on top of the situation in that sense. This is something that's highly infectious, in which case you can have many cases at once. And that readily, there's almost no health system that has that much spare space, to take care or to take in so many patients at once. Not only so, because it's quite infectious, it also means that when you have a COVID case in a hospital, it's kind of overwhelming, because you can't manage it along with everything else just casually on the same ward and all that. So its management is more meticulous, takes up more resources, human time and all of that, than other things. So that's why it easily also overwhelms. Apart from the number of cases that you can have at once, the resources required, the delicate nature of the kind of care you require in order not to infect everybody else, including the health workers, makes it quite tedious to manage. And that's why it is so. But if you look at all the countries, it's difficult to compare them.
I wasn't asking for a comparative analysis.
Yes.
I was asking about Nigeria's performance specifically, not relative to any other country.
Yes. Okay. Well, given the space where we're in, it's a case of, like the economists will talk about supply and demand. Say testing, for instance, that you mentioned. If all of a sudden, as we have it now, everybody requires to do testing for the same disease condition in every country in the world, that all of a sudden means that the same reagents you are looking for, which you are not manufacturing, by the way, is the same that others are also trying to import and all of that. So all of a sudden you'll have very serious issues where some of these things are concerned. So that's why I'm trying to say that it's not exactly just to say, oh, we're not doing what we should. It's the situation that we found ourselves in. If you take malaria, for example, when the drug treatment, first-line treatment, was changed from chloroquine to artemisinin combination therapy, the cost shot through the roof. Why? Because all of a sudden the whole world is looking for the same drug, which basically is coming from the back of a tree. So how many trees can you grow overnight? So that's the kind of situation we're in, where things like testing is concerned. But night and day, there are people who are not sleeping, trying to get this done, trying to get that done, ensure that the testing is ramped up. But how much testing exactly do we even think is required in order to get us through the woods? You probably need to do so many tests, and I'm talking of millions of tests every 2 weeks. That is a whole lot.
Right. A lot of people are even talking about the test, the veracity of the tests. Can you give us sort of like an ironclad certainty on the test itself? Secondly, I want to talk about the drugs that we got in from Bangladesh. You know anything about that? You can pull us through as regards that?
Okay, well, let me just say I don't know about the drug from Bangladesh, but it's not unexpected that you get many things coming up in this kind of circumstance, okay? But that aside, going back to the test, Nigeria, one of the issues with Nigeria's testing situation is the fact that Nigeria has not been using rapid test kits, okay? And that is not in itself a bad thing, okay? Because the reason why that is not happening is because those tests are not validated. Nigeria has chosen to go by the road of using the gold standard test, which is the PCR test, which takes longer to do However, which gives you more certainty that if the test is positive, it is indeed positive. If it's negative, it is indeed negative. But when you have a rapid test kit, and especially you have not validated, you could get a lot of false positives and a lot of false negatives. And that has a lot of implications for the individual as well as for the population as a whole.
Well, Dr. Odubanjo, we'll soon go on a short break, but before we do so, how do we address the challenge of the shortage of bed spaces? The Presidential Task Force had said every state should have at least a facility that can accommodate up to 300 persons. But we're also told that only about 6 states have been able to meet that target. And now we have the PTF saying patients that are asymptomatic will be discharged after 10 days. The ones that have symptoms will be kept for 14 days. I guess this is to manage the challenge of bed spaces. But what's your advice to the states and also to the Presidential Task Force? We'll take a short break. When we return, you can then respond to the question. We'll be right back. Welcome back to the morning show here on Arise News. Still with us, we have Dr. Odubanjo, former chairman of the Lagos chapter of the Association of Public Health Physicians. Dr. Odubanjo, thank you for staying with us. I had asked you a question about how Nigeria can best manage the challenge of bed spaces.
Well, one of the things that will probably change that for us is the fact that some of the discharge criteria has been, the discharge criteria has been revised, and it's revised actually based on current knowledge or research. Every day people are working globally trying to understand this infection. And some of the things they're finding out is that people are probably not as infectious after some days as it was thought they would be. So again, the question of how long do you keep people on the bed? If they're in isolation, they're asymptomatic, at least, so they don't really need any treatment per se. And they're not thought to be infectious, so why would you keep them for so long still waiting for them to be negative? So NCDC started revising some of those things recently. That will create more spaces because we were having people being kept on admission for much longer while we waited for negative tests, which took a while. So I think that's one way to go. Of course, this is also tied to this flattening the curve thing that we talked about. Because if you don't have a flat curve, then you are having more cases than you can handle. So at the end of the day also, actually, some of the issues with how you balance, lockdowns, easing the lockdown and all that, are all related to flattening the curve somewhat. Because again, to a certain extent, what it looks like is that this is going around, many more people will be infected than we know of. All over the place without symptoms. They'll be asymptomatic and all of that. But what you want to do is that you don't want them to be very sick people who might need admission. You want people also to quickly, the moment they feel they've been exposed or they feel they have moderate infection, they feel a little sick, you want them to self-isolate so that they don't at least infect other people who might be more sick, in fact, than they were. So these are all little control measures, a little dicey because it's something that has not been dealt with before anywhere in the world. But as the research is coming out, you are fine-tuning what you're dealing with, and then you are also trying to use that to balance out what your response should be. However, that said, you mentioned there should be some minimum capacity based on the risk you think a state will bear eventually. So the states should have a minimum bed space capacity that can handle cases. It will be foolhardy to think that we don't need it or you have just 10 spaces in any state. You probably need quite a bit more than that, in your preparations. But I think it's a situation that can be or has to be balanced out carefully. There's also been talk of home management. All of those are very difficult things to juggle. None of them are easy things. There are no easy answers here, but again, we'll find our way through eventually.
Thank you, Doctor. Now, the National Association of Resident Doctors of Nigeria has announced plans to go on strike on Monday, June 15th, which is just around the corner. And they have specified that there will be no exemptions, including emergency wards or COVID-19 isolation and treatment centers. And this, obviously, on a normal day, in the best of circumstances, will be a disaster. But in the middle of a pandemic, it is a cataclysmic disaster. I mean, what is your assessment of this situation? Their demands, to the layman, I suppose, are not unreasonable. I mean, reinstating some colleagues in Just University Teaching Hospital that were sacked, paying arrears of salaries, increasing the inadequate PPE. So what has caused this problem? Why are we, looking at impending strike action?
Well, I think it's a sad situation we found ourselves in, but it's also it's like we are being jolted back to reality. That for too long we've neglected the health sector, we've taken it for granted. For instance, you were mentioning now that one of the reasons for the threatened strike is salaries, backlog of salaries. It's unheard of. It's unthinkable that even without COVID, you would hold your doctors' salaries, and you expect that they can be, they can have the presence of mind to treat people. I mean, we're talking about cases of life and death. You expect they can do their best while they are worried about paying rent, worried about paying children's school fees, and yet they can open up somebody on a surgical table and operate on them. So I think it's jolting us back to reality that we have taken this sector for granted for too long. People have asked me sometimes and said, well, with the COVID crisis, we're going to see the health sector really improve. And I tell them I'm pessimistic, unfortunately. And the reason why I'm pessimistic, sometimes I tell them, look at how many strike actions and threatened strike actions we've had in the last 2-3 months in the middle of COVID-19 pandemic in Nigeria, different states, cross from Abuja to Ogun State to this. I said that is telling us a story. Worse still is look at the reaction of the government to these strike actions or threatened strike actions. If we can't get it, in the middle of a crisis like this, then we're not likely to get it when the crisis is not there. So we really need to sit back, address these things properly, and realize, because what COVID should be telling us is that this is very important. The sector is very important. And in that sector, the personnel are very important. They must be treated well. It got so bad in the UK, for instance, once they were approaching the peak of the infection, they called back retired doctors, nurses, come back to work. We will pay you. That's how serious it was for them, that, look, we need the personnel. And yet their health worker ratio to population is way better than our own in Nigeria. But they still knew that if they were going to survive this in any way positive, at all, they will have to have more hands on ground. We are losing the people. They are leaving the country every day. And what we do now, with this kind of strike actions, is going to tell them a message. It's sending a message to them about whether they are needed or not. Meaning that once the borders are open, how many more of them who were not thinking of leaving the country might actually now decide they have to leave this country. So we need to handle this right. I think it's a sad but important message to us that something is really wrong in that sector and we must deal with it appropriately.
As we quickly wrap up, Doctor, I want to talk about reopening of churches, religious centers, and other high activity areas. What should be the thinking behind this?
Well, I think on one hand, most of these places that we're worried about, once we have the right guidelines, I think they have the capacity to actually follow those guidelines meticulously, perhaps more than some of the other places that people have been going to, like the markets, and even with the banks. When we eased the lockdown, we saw what happened. But I think even the churches and the mosques have the capacity to do even better than that because people listen to the leadership there. We have an advantage in this, actually. If we look at it from the positive side, we can take it and make it work to our advantage. And that is, we can use those places to pass across messages. Once they have the guidelines and they stick to them, which I believe they will, we can use them as places where the right messages can be passed across to people. And the people listen to them, they believe them, they respect them, which is not the same that can be said about many other types of leadership in Nigeria. So we can use that to a serious advantage. Then secondly, we oftentimes ignore mental health when we talk about health in Nigeria, and that is the well-being of the people. People are losing jobs. People are afraid of losing jobs. All kinds of things are wrong. There's a lot of tension. So again, we can get the advantage of some kind of psychotherapy that happens when people get to go to the church or the mosque to pray. It gives hope. So we shouldn't completely look down on this. We should look at it from the advantageous side, as long as appropriate measures are put in place for people's safety, which basically will be achieving social distancing. Some of these places also will provide a lot of palliatives for people, which will again ease tension in the land. So I think it can work to our good if we put out the right guidelines, ensure they understand it, and then we can use even that to our advantage.
Well, thank you very much, Dr. Odubanjo, for joining us this morning on the Morning Show.
Thank you, Doctor.
Thank you very much indeed.
Thank you so much, Doctor.